Good morning, good afternoon, good evening, wherever you are in the world now. Welcome to our 5th anniversary of Cochrane Rehabilitation. We are very happy for this anniversary, and I will immediately share with you my slide, and I will introduce you to our meetings, because in fact we have a meeting today and some other in the next day. Our anniversary will be presented in 3 different webinars that are being arranged so to cover all the world and the different time zones in the world. The first 2 webinars will concentrate on our past and present, while also looking at the future. And so today we will discuss the future of Cochrane Rehabilitation in light of the new Cochrane strategy for change. We will discuss methodological issues. We will discuss knowledge translation activities. And this will be done through interviews made by younger colleagues to some of the protagonists of these years of work, these 5 years of work of Cochrane Rehabilitation. And we will conclude with a questions and answer session. Tomorrow, we will face different topics. So we will discuss low and middle income countries, the contribution that we can give to low and middle income countries. We will speak about education, and we will speak about the WHO rehabilitation program and all the work that we are doing with them and for them. And then we will have another question and answer session. Then on the 16th of December, we will have some workshops that will not be educational workshops. They will be working workshops aimed to develop the ideas for the next 5 years. And we will focus on 6 topics divided in 6 groups. So about involvement of wider involvement of all the rehabilitation community, usefulness for low and middle income countries, how to help impacting health policies with evidence in rehabilitation, how to provide education, how to improve methodology, and finally, how can the rehabilitation community contribute to the Cochrane strategy for change? So what we can give and not only what we can receive from Cochrane. We started 6 years ago, 6 years and a half ago, with very conscious of the situation, of the constant boulder on rehabilitation shoulders of the say in rehabilitation there is no evidence. And that was raised into the European Society of Physical and Rehabilitation Medicine. And we founded the EBM committee in that society. And immediately it was clear to all of us that we had to discuss with Cochrane. Cochrane being the most important collaboration of people around the world discussing about evidence and how to improve health through evidence. So we started discussing with Cochrane, and in 1 year and a half, we built this bridge that exists now for between the world of Cochrane and all the rehabilitation community. And this is what we want to do, to serve as a bidirectional bridge, conveying the evidence of Cochrane to the rehabilitation community and conveying the needs of the rehabilitation community to Cochrane. The results in these 5 years have really been impressive. And you can see there some of the numbers in terms of papers, of Cochrane Corners, newsletters, blog shots, the outstanding number of followers. We tagged all the reviews. We had multiple workshops, lectures, and presentation. We have 6 special projects going on. But I don't want to speak about numbers. Today is our anniversary, and we present frequently those numbers. Today, I want to speak about people. And so we have to recognize the 8 early promoters. And you can see there a couple of photos from our launch of Cochrane Rehabilitation in Rovato in autumn 2016. And nowadays we are organized in quite a complex way, with an incredible number of people who are voluntarily helping us, with very few people that are paid by some institutions that are greatly supporting our work. So we have an executive committee in which are represented the 5 current working areas. So we are working on methodology, we are working on communication of what is produced by Cochrane. Centrally, we are working on identifying all the reviews of interest for rehabilitation. We are working on publishing Cochrane Corners, and we are working on developing tools to educate the rehabilitation community toward evidence and toward Cochrane reviews. And we are supported by an incredible group of young people. As is usual with young people, they change in time. So on the right, you see the first group of people that was working with us. And on the left, in the bigger photo, the last group of the headquarters with some other colleagues that were not present at that dinner. It was the first dinner we had with our headquarters a few weeks ago. We have an important number of people in our advisory committee that here are represented all the people in the executive committee, all the founders, and all the main advisors of our everyday work. But also we rely on our advisory board. Our advisory board was created since the start, and we aim at really involving all the rehabilitation community. And we have in our advisory board 12 scientific journals. We have 5 global scientific societies, 4 regional scientific society, 3 Cochrane groups, 4 experts, and 4 representatives. And this group is constantly changing, but the figure you see on the bottom there is our first meeting that happened in Buenos Aires 2017. And it was one of the first times that all this global community of rehabilitation met and was around a topic that was felt important by all of us, evidence. We have also another very important group for the action, the Recover action that we started since the start of the pandemic. We are working a lot, as you all know, on COVID-19, and this steering committee is serving, represented by 13 people with from 7 different professions from all the 5 continents, supporting our activities against COVID. And our activities obviously focus on the evidence that is collected every day by our rehabilitation community. We started an initiative that are our methodology meetings. And that was started in Paris 2018, and almost every year we had one meeting, and luckily we had 2 in 2020 just before the pandemic, so we could jump the 2021 and we will go to 2022 for the next one. You can see in these photos the people who participated, and we gradually have been able to develop some contribution that we really think could help and could serve to improve our work in gathering evidence in rehabilitation. And one of these initiatives is really probably the biggest and widest one, is the RC-Track guideline reporting guidelines project. And there we have 2 big groups, one of executive that already worked on this with 29 experts from 16 countries and 4 continents, plus an advisory group with other 39 experts, 21 countries, 6 continents. These numbers are really impressive. As impressive is the number of societies and groups and individual universities and hospitals we sign contracts. So beyond the Fondazione Don Carlo Gnocchi in Milano, the Istituto Ortopedico Galeazzi in Milano, the Montecatone Rehabilitation Institute, who are supporting us directly, and beyond the European Physical and Rehabilitation Medicine bodies, so the European Society, the UMS, PRM section and board, the European Academy of Rehabilitation Medicine, and beyond the International Society of Physical and Rehabilitation Medicine. These are all the people that are supporting us through direct grant to collect evidence serving all our community. We have plenty of other little groups and plenty of national societies that are working for us with different activities. And we are particularly proud of all the work that we are doing with WHO, the World Health Organization. We started immediately with the launch of Rehabilitation 2030 that was in February 2017, 2 months after the foundation of Cochrane Rehabilitation. And we worked with the WHO for the package of interventions in rehabilitation, and then more and more around COVID-19 and rehabilitation and the post-COVID condition and rehabilitation. And we are gathering evidence for the WHO for their guidelines. And I like to think that Cochrane Rehabilitation, in fact, surfed on a wave that was there. What is the wave of the need for evidence that all the rehabilitation community was feeling and is feeling constantly, and the Cochrane Rehabilitation was there to support and to work on this wave to help our community.